Which of the following antifungal agents interacts with cytochrome P450-dependent sterol 14-demethylase to inhibit ergosterol synthesis in many fungal organisms, as well as in gram-positive bacteria and protozoans? A. Ketoconazole. B. Amphotericin B. C. Flucytosine. D. Zidovudine. E. Griseofulvine. The answer is A. Ketoconazole. The mechanism of amphotericin B involves ergosterol, but the mechanism is not related to ergosterol synthesis. Amphotericin B binds to ergosterol in the cell membrane, disrupting its permeability to ions. Ketoconazole and other imidazoles interact with cytochrome P450 to inhibit P450-dependent synthesis of ergosterol by sterol 14-demethylase. Griseofulvine interacts with microtubular protein to inhibit fungal mitosis. Flucytosine incorporates into RNA and disrupts fungal protein synthesis. Zidovudine is used primarily as an antibiotic and not as an antifungal agent. Antibiotics that inhibit bacterial cell wall synthesis include which of the following? A. Quinolones. B. Aminoglycosides. C. Tetracyclines. D. Sulfonamides. E. Vancomycin. The answer is E. Vancomycin. Vancomycin is the correct answer. Antibiotics that inhibit bacterial cell wall synthesis include the beta-lactam antibiotics, penicillins and cephalosporins, vancomycin, and bacitracin. Which is a glycoprotein, produced by many mammalian cells, and used in the treatment of hepatitis, papillomaviruses, hairy cell leukemia and AIDS-related Kaposi's sarcoma? A. Acyclovir. B. Zalcitabine. C. Idaguridine. D. Interferon. E. Zidovudine. The answer is D. Interferon. All the listed agents are synthetic analogues, except interferon, which is a glycoprotein produced by many types of mammalian cells. It has been shown to be useful in treatment of hepatitis, papillomaviruses, hairy cell leukemia and AIDS-related Kaposi's sarcoma. Idaguridine, as its name implies, is a synthetic pyrimidine analog, which inhibits viral DNA polymerase. Zidovudine and zalcitabine are also synthetic pyrimidine analogues, but they inhibit reverse transcriptase and act as chain terminators. Acyclovir is a synthetic purine analog which requires viral thymidine kinase to be converted to an active phosphorylated form, which then inhibits viral DNA polymerase. Certain helminthic infestations can spread to the CNS. Pretreatment with which class of drugs is required prior to diethylcarbamazine administration? A. Diuretics. B. Antiviral drugs. C. Anticoagulants. D. Opiates. E. Steroids. The answer is E. Steroids. LoLo is an extraintestinal nematode, which may migrate to the CNS, causing encephalitis. Diethylcarbamazine is successful in treating LoLo but will exacerbate the encephalitis unless steroids are used first to treat the symptoms of the encephalitis. Other side effects of diethylcarbamazine may be due to rapid death of nematodes and release of various toxic substances. Symptomatic treatment might be appropriate with a number of pharmacological classes, but most symptoms will resolve as the body is cleared of dead and dying nematodes. A 52-year-old man presents with a 3-day history of persistent diarrhea, having up to 7 watery bowel movements without bleeding a day. He has associated lower abdominal cramping and notes mild nausea. He denies travel outside of the country. He does not recall eating anything unusual, and none of his family members are sick. Past medical history is significant for GERD, for which he takes Protonix daily. He recently had an upper respiratory infection and completed a course of oral levofloxacin approximately 3 weeks ago. A stool sample is obtained. Stool is negative for ova and parasites, but PCR testing is positive for Clostridium difficile. What is the appropriate first-line treatment in this patient? A. Metronidazole. B. Prednisone. C. Clindamycin. D. Loperamide. E. Lamotrigine. The answer is A. Metronidazole. The patient is infected with Clostridium difficile, a gram-positive, spore-forming bacillus. It is manifested by watery diarrhea, which left untreated can progress to fulminant colitis. Previous antibiotic use is the leading cause of Clostridium difficile, as the use of antibiotics alters the normal colonic flora, allowing Clostridium difficile to proliferate. Patients who have confirmed infection should first discontinue any offending antibiotics. The patient is then treated with either oral metronidazole or oral vancomycin. Due to its cost, oral vancomycin is typically reserved for severe or recurrent cases of Clostridium difficile. Which of the following drugs is useful in treating infections from Mycobacteria leprae? A. Isoniazid. B. Pyrazinamide. C. Cycloserine. D. Dapsone. E. Ethambutol. The answer is D. Dapsone. Dapsone has been the worldwide standard for treatment of leprosy. The other agents listed are used in treatment of tuberculosis. Leprosy, also called Hansen's disease, is a long-term infection caused by the bacteria Mycobacterium leprae or Mycobacterium lepromatosis. It affects the skin, mucous membranes, and nerves, causing discoloration and lumps on the skin. A 30-year-old man with HIV is being treated with antiviral agents. 4 weeks after initiating therapy, he presents with weakness and fatigue. Laboratory studies reveal anemia, leukopenia and thrombocytopenia indicating bone marrow suppression. What antiviral agent is most likely the cause of his symptoms? A. Tenofovir. B. Zidovudine. C. Nelfenavir. D. Acyclovir. E. Lamivudine. The answer is B. Zidovudine. Zidovudine, ZDV, formerly called azithromycin, is active orally and is distributed to most tissues. The primary toxic side effect of ZDV is bone marrow suppression leading to anemia and neutropenia, which may require transfusions. Additional side effects include thrombocytopenia, gastrointestinal distress, headache, myalgia, acute cholestatic hepatitis, agitation, and insomnia. The other choices are incorrect. Acyclovir is commonly used for the treatment of mucocutaneous and genital herpes lesions and for prophylaxis in AIDS. Acyclovir has no significant toxicity on the bone marrow. Nelfonavir is a protease inhibitor that is characterized by a short half-life and has a number of drug interactions, but its primary adverse effect is diarrhea, and it has the most favorable safety profile in pregnancy. It is not associated with bone marrow suppression. Lamivudine is a nucleoside inhibitor and is an active inhibitor of HIV reverse transcriptase. It is used in the treatment of hepatitis B virus infection. The drug is remarkably non-toxic and adverse effects are mild. Tenofovir is a nucleoside reverse transcriptase inhibitor and anti-HIV drug that competitively inhibits reverse transcriptase and causes chain termination after incorporation into DNA. Adverse side effects include gastrointestinal distress, asthenia, and headache but not anemia, leukopenia, or thrombocytopenia. Which of the following is an analog of guanine, a purine, and is transformed by viral thymidine kinase before it can inhibit viral DNA polymerase in viruses that are actively replicating? A. Zalcytabine. B. Interferon. C. Idaxuridine. D. Acyclovir. E. Zidovudine. The answer is D. Acyclovir. The chemical type of an antiviral compound is often important in determining its potential mechanisms and, therefore, its utility against specific types of viruses. Interferon is a glycoprotein produced by many types of mammalian cells. It stimulates host mechanisms to prevent viral penetration and also inhibits viral protein synthesis. Idaxuridine, as its name implies, is a pyrimidine, which inhibits viral DNA polymerase. Zidovudine and zalcytabine are also pyrimidines, but they inhibit reverse transcriptase and act as chain terminators. Only acyclovir is a purine that requires viral thymidine kinase to be converted to an active phosphorylated form, which then inhibits viral DNA polymerase. Which of the following anthelminthic drugs must be administered intravenously and may cause albuminuria due to accumulation in the kidney, photophobia, and papular eruption? A. Zidovudine. B. Praziquantel. C. Suramin. D. Diethylcarbamazine. E. Ivermectin. The answer is C. Suramin. Suramin must be administered intravenously and should be used cautiously in patients with kidney disease. It inhibits protein kinases and dihydrofolate reductase and reduces ATP synthesis. It is used in the treatment of certain extraintestinal nematodes and is probably one of the most toxic anthelminthic agents. The other choices are incorrect. Diethylcarbamazine is rapidly absorbed following oral administration and increases the susceptibility of extraintestinal nematodes to host antibodies. Ivermectin is used to treat onchocerca volvulus in humans and is rapidly absorbed following oral administration. The primary use of praziquantel, which is rapidly absorbed orally, is in the treatment of infection from flatworms and flukes where it reduces the resistance of the parasite to host immune mechanisms. Zidovudine is also administered orally, but is used for treatment of AIDS, where most of its toxic symptoms are hematologic. A 42-year-old immigrant from Pakistan comes to your office after his wife noted hypopigmented anesthetic patches on his back. On further examination, you discover bilaterally thickened ulnar nerves. Skin biopsy reveals numerous acid-fast bacilli and a negative lepromin test. What combination of drugs would you recommend for this patient? A. Ethambutol, isoniazid, clofazimine. B. Dapsone, clofazimine, rifampin. C. Pyrazinamide, rifampin, isoniazid. D. Dapsone, clofazimine, ethambutol. E. Isoniazid, rifampin, dapsone. The answer is B. Dapsone, clofazimine, rifampin. Combination therapy is recommended for all types of leprosy to avoid the emergence of resistance. Cases of lepromatous leprosy are treated with a combination therapy involving the use of the following: dapsone, rifampin, clofazimine. This combination is given for 2 to 3 years, ideally till the skin biopsies are negative. Combination therapy is recommended for all types of leprosy to avoid the emergence of resistance. Cases of lepromatous leprosy are treated with a combination therapy involving the use of the following: dapsone, rifampin, clofazimine. This combination is given for 2 to 3 years, ideally till the skin biopsies are negative. Cases of indeterminate, borderline, and tuberculoid leprosy are treated with a combination therapy involving the use of the following: dapsone, rifampin for 6 to 12 months followed by dapsone, alone, for 2 years. Foscarnet is toxic to which of the following organs? A. Bladder. B. Liver. C. Heart. D. Kidneys. The answer is D. Kidneys. Foscarnet is an antiviral medication which is primarily used to treat viral infections involving the herpes viridae family. It can cause damage to the kidneys. To reduce the damaging effect, the patient may be put on intravenous fluids. What is acyclovir's mechanism of action? A. Reverse transcriptase blocker. B. M2 channel inhibitor. C. Guanosine analog. D. Neuraminidase inhibitor. The answer is C. Guanosine analog. Acyclovir is a guanosine analog, which works by inhibiting viral DNA polymerase. This slows down the rate at which viruses can replicate. Acyclovir is used primarily in the treatment of herpes simplex viruses 1 and 2, chickenpox, and shingles. Allopurinol is used for what condition? A. Gout. B. Hypertension. C. Kidney stones. D. Type 2 diabetes. The answer is A. Gout. Allopurinol is a purine analog and xanthine oxidase inhibitor used in the treatment of chronic gout. Which of the following drugs is used in the treatment of osteoporosis? A. Budesonide, formoterol. B. Sitagliptin. C. Alendronic acid. D. Infliximab. The answer is C. Alendronic acid. Alendronic acid, trade name Fosamax, is a bisphosphonate used in the treatment of osteoporosis. Bisphosphonates reduce bone loss by encouraging apoptosis in osteoclasts. Infliximab is a tumor necrosis factor alpha, TNF-alpha, blocker used in the treatment of rheumatoid arthritis and several other autoimmune conditions. Sitagliptin, trade name Januvia, is a diabetes medication. Budesonide, formoterol, trade name Symbicort, is a combination long-acting beta agonist and corticosteroid used in the treatment of asthma. The answer is D. To drink 3,000 milliliters of fluid a day. The nurse should instruct a patient on allopurinol to drink 3,000 milliliters of fluid a day to reduce the risk of kidney stone formation. When allopurinol is prescribed to a client, it is best for the nurse to include the following instructions. A. That the effect of the medication will occur immediately. B. To take the medication on an empty stomach. C. That if swelling of the lips occurs, this is a normal expected response. D. To drink 3,000 milliliters of fluid a day. The client prescribed cholesterol and has been given instructions for taking the medication. The nurse would recognize a need for further instructions if the client said, A. I will store the medication at room temperature. B. A high-fiber diet is important while taking this medication. C. This medication will help lower my cholesterol. D. This medication should only be taken with water. The answer is D. This medication should only be taken with water. Cholestyramine is a bile acid sequestrant, which binds bile in the gastrointestinal tract to prevent its reabsorption. It removes bile acids from the body by forming insoluble complexes with bile acids in the intestine, which are then excreted in the feces. As a result of this loss of bile acids, more plasma cholesterol is converted to bile acids in the liver to normalize levels. This conversion of cholesterol into bile acids lowers plasma cholesterol levels. It should be taken with meals and water. The dosage should be administered once or twice daily, with a maximum of 6 times daily. Cholesterol binds bile in the gastrointestinal tract to prevent its reabsorption. Which of the following is a potential side effect of prednisone? A. Adrenal suppression. B. Weight gain. C. Hyperglycemia and diabetes. D. All of these. The answer is D. All of these. There are many potential side effects of prednisone, including all those listed in the answer choices: headache, fatigue, acne, seizures, upset stomach, changes in mood, difficulty breathing, dry cough, vomiting, depression, heartburn, muscle weakness, irregular heartbeat, tremors, inability to properly thermoregulate, and many others. The nurse anticipates administration of milk of magnesia, magnesium hydroxide. Which of the following patient conditions may affect the nurse's decision to administer magnesium hydroxide? A. Indigestion. B. Constipation. C. Peptic ulcer. D. Stress ulcer. E. Reflux esophagitis. The answer is B. Constipation. The nurse must consider potential side effects of medications before administering them. Milk of magnesia, magnesium hydroxide, has three major actions. Anti-ulcer action: magnesium hydroxide neutralizes gastric acid, decreasing the direct acid irritant effect. This increases pH, which, in turn, leads to pepsin inactivation. Drug also enhances mucosal barrier integrity and improves gastric and esophageal sphincter tone. Antacid action: drug reacts rapidly with hydrochloric acid in the stomach to form magnesium chloride and water. Laxative action: magnesium hydroxide produces its laxative effect by increasing the osmotic gradient in the gut and drawing in water, causing distension that stimulates peristalsis and bowel evacuation. The laxative action of magnesium hydrochloride can exacerbate the patient's current condition if he is constipated. The psychiatric nurse cares for a patient with major depressive disorder admitted after a suicide attempt. The primary care provider has prescribed fluoxetine, which the patient has never taken before. Which of the following statements is important for the nurse to say to the patient? A. You should take this medication in the morning because it can cause insomnia. B. This medication takes at least 4 weeks to work. C. You may experience changes in your bowel movements such as diarrhea or constipation. D. You may experience changes in appetite and weight. E. You could begin to feel more anxious. The answer is B. This medication takes at least 4 weeks to work. Fluoxetine is a selective serotonin reuptake inhibitor, SSRI, commonly prescribed to patients diagnosed with depression. It may cause changes in appetite and weight, increase anxiety and insomnia, or cause bradycardia or palpitations. It is most important for the nurse to educate the patient that the therapeutic effect of fluoxetine may take up to 4 weeks, as the patient has a previous suicide attempt, and may experience suicide ideation before the effect occurs. The nurse prepares to administer medications on the psychiatric unit. The patient is prescribed phenelsin sulfate for depression. Which of the following is the nurse's priority education when administering this medication? A. Effect of medication takes 3-4 weeks to work. B. Avoid tricyclic medications until 3 weeks after stopping. C. Potentiates alcohol and other medications. D. Avoid foods with tyramine. E. Wear sunblock. The answer is D. Avoid foods with tyramine. Phenelsin is a monoamine oxidase inhibitor, MAI, that treats depression. Patients who take MAIs should avoid foods with tyramine due to an increased risk for hypertensive crisis. Tyramine-rich foods include those that are fermented, heavily marinated, pickled, smoked, or heavily marinated. Also, chocolate and alcoholic beverages have significant amounts of tyramine. In addition to education about diet modification, nurses must educate patients of the signs of hypertensive crisis, which are headache, sweating, palpitations, stiff neck, and intracranial hemorrhage. All of the other listed patient educations are essential, but the priority is to avoid tyramine due to the risk for hypertensive crisis, which is life-threatening. A client being treated for type 2 diabetes has recently been prescribed an oral hyperglycemic medication and has inquired how the medications will keep his blood sugar levels under control. The nurse informs the patient the medication prescribed will reduce glucose production by the liver and increase insulin sensitivity but will not increase insulin production. Based on this description, which diabetic medication has this client been prescribed? A. Metformin. B. Sitagliptin. C. Exenatide. D. Glipizide. E. Glyburide. The answer is A. Metformin. The only medication mentioned that does not actually stimulate insulin production is metformin. This medication is a biguanide. Its mechanism of action includes decreasing hepatic glucose production, and increases insulin sensitivity. A 26-year-old pregnant client presents to labor and delivery in premature labor. The doctor has ordered a tocolytic medication to help in stopping the contractions. Which of the following medications is effective in managing premature labor contractions? A. Pitocin. B. Naproxen. C. Terbutaline sulfate. D. Calcium gluconate. E. Misoprostol. The answer is C. Terbutaline sulfate. Terbutaline sulfate is a tocolytic agent, as well as a bronchodilator effective in stopping premature labor contractions. Both pitocin and misoprostol are used to induce labor. Calcium gluconate in labor is used to reverse magnesium sulfate, another tocolytic. Naproxen is an NSAID. You are the nurse at a psychiatry clinic taking care of a 47-year-old male who complains of 3 months of depressed mood and fatigue. His physician starts him on venlafaxine. Which of the following best describes the mechanism of action of venlafaxine? A. Beta-adrenergic blocker. B. GABA agonist. C. Selective serotonin reuptake inhibitor, SSRI. D. Serotonin norepinephrine reuptake inhibitor, SNRI. E. Monoamine oxidase inhibitor, MAOI. The answer is D. Serotonin norepinephrine reuptake inhibitor, SNRI. Venlafaxine functions by blocking the reuptake of both serotonin and norepinephrine, and thus is classified as a serotonin norepinephrine reuptake inhibitor, SNRI. Venlafaxine is used to treat a number of conditions including depression, anxiety, panic attacks, and social phobia, among others. In addition to its antidepressant properties, it is also useful in that it can provide the benefit of increased energy in some patients due to the norepinephrine reuptake inhibition, effectively increasing the effect of norepinephrine. Selective serotonin reuptake inhibition, SSRI, is incorrect because venlafaxine is an SNRI, not an SSRI. An example of an SSRI is fluoxetine. Monoamine oxidase inhibition, MAOI, is incorrect because venlafaxine is an SNRI, not an MAOI. An example of an MAOI is phenelzine. An example of a GABA agonist is phenobarbital, a barbiturate. An example of a beta-adrenergic blocker is propranolol. You are the nurse taking care of a 24-year-old female with major depressive disorder. She is started on phenelzine, a monoamine oxidase inhibitor, MAOI. To avoid serious adverse effects, including hypertensive crisis, you should warn her to avoid which of the following foods? A. Aged cheeses. B. Carrots. C. Green, leafy vegetables. D. Grapefruit juice. E. Beets. The answer is A. Aged cheeses. MAOIs, when combined with food or drink products containing the metabolite, pteramine, have the potential to cause serious adverse effects including hypertensive crisis. Pteramine is found most commonly in aged cheeses and cured meats. Thus, since this patient is taking an MAOI, she should be advised to avoid aged cheeses. Carrots, beets, grapefruit juice, and green, leafy vegetables do not need to be avoided in patients taking MAOIs. You are the nurse taking care of a patient with schizophrenia. You administer the patient's medications and note that he is receiving haloperidol. Which of the following best describes the mechanism of action of haloperidol? A. Norepinephrine dopamine reuptake inhibitor. B. Increased efficiency of GABA receptor binding. C. Selective serotonin reuptake inhibitor. D. Serotonin norepinephrine reuptake inhibitor. E. Dopamine D2 receptor antagonist. The answer is E. Dopamine D2 receptor antagonist. Haloperidol is a first-generation antipsychotic, also known as a typical antipsychotic medication, and functions by selectively antagonizing dopaminergic D2 receptors. Haloperidol is used to treat a number of conditions including schizophrenia, bipolar disorder, manic phase, acute psychosis, tics from Tourette syndrome, and delirium, among others. Increased efficiency of GABA receptor binding describes the mechanism of action of benzodiazepines, not haloperidol. Selective serotonin reuptake inhibition does not describe the mechanism of action of haloperidol. This describes medications like fluoxetine and escitalopram. Serotonin norepinephrine reuptake inhibition does not describe the mechanism of action of haloperidol. This describes medications like venlafaxine and desvenlafaxine. Norepinephrine dopamine reuptake inhibition does not describe the mechanism of action of haloperidol. This describes medications like bupropion and methylphenidate.